Welcome to this pharmacology test on antiarrhythmic drugs, essential for managing arrhythmias. This test includes 10 multiple-choice, scenario-based questions designed to assess and deepen your understanding of the topic. Each question provides 5 options and includes detailed explanations for the correct answer. Use these questions as a valuable tool for practice and mastery. Let's begin. Question 1. Mrs. Johnson, a 45-year-old female with recurrent supraventricular tachycardia, is prescribed verapamil. She also has a history of heart failure and asthma. Which of the following is a contraindication to using verapamil in her case? Option A, atrial fibrillation with a rapid ventricular response. Option B, heart failure with reduced ejection fraction. Option C, history of asthma. Option D, use of beta blockers. Option E, hypertension. The correct answer is option B, heart failure with reduced ejection fraction. The explanation is that verapamil, a calcium channel blocker, is contraindicated in heart failure with reduced ejection fraction, HFrEF, due to its negative inotropic effects, which can exacerbate heart failure. Verapamil reduces myocardial contractility, which can further impair the already compromised cardiac function in HFrEF. While asthma and beta blocker use require caution with other medications, these conditions are not direct contraindications for verapamil. Question 2. Mrs. Taylor, a 30-year-old pregnant female with a history of paroxysmal supraventricular tachycardia, PSVT, is being treated with adenosine. Which of the following statements about adenosine is incorrect? Option A, it has a very short half-life. Option B, it acts by blocking AV nodal conduction. Option C, it is contraindicated in pregnancy. Option D, it is administered via rapid 4 bolus. Option E, it can cause transient chest discomfort. The correct answer is option C, it is contraindicated in pregnancy. The explanation is that adenosine is not contraindicated in pregnancy and is often used as the first-line treatment for acute PSVT in pregnant patients. Its short half-life and rapid clearance from the body make it safe for both the mother and fetus. Adenosine works by transiently blocking AV nodal conduction, which terminates PSVT, and while it can cause transient chest discomfort, these effects are typically short-lived and self-limiting. Question 3. Mr. Green, a 72-year-old male with chronic kidney disease, CKD, and atrial fibrillation, is prescribed dofetilide for rhythm control. Which of the following is an absolute contraindication to the use of dofetilide? Option A, QTC interval greater than 440 milliseconds. Option B, serum potassium of 4.2 milliequivalent per liter. Option C, creatinine clearance less than 20 milliliters per minute. Option D, history of atrial fibrillation. Option E, normal sinus rhythm. The correct answer is option C, creatinine clearance less than 20 milliliters per minute. The explanation is that dofetilide is primarily excreted by the kidneys, and in patients with severe renal impairment, creatinine clearance less than 20 milliliters per minute, the drug can accumulate, increasing the risk of life-threatening arrhythmias like torsades de pointes. While a prolonged QTC interval also necessitates caution, it is not an absolute contraindication if monitored. Proper dose adjustments and monitoring of renal function are essential for safe use of dofetilide. Question 4. Mr. Adams, a 58-year-old male with atrial flutter, is prescribed flecainide. Which of the following is not a recommended use or precaution for flecainide? Option A, avoid in patients with structural heart disease. Option B, effective for atrial fibrillation conversion. Option C, causes QT interval prolongation. Option D, administered orally. Option E, safe in chronic kidney disease without dose adjustment. The correct answer is option E, safe in chronic kidney disease without dose adjustment. The explanation is that flecainide requires dose adjustment in patients with chronic kidney disease due to its renal excretion. Accumulation of the drug in patients with impaired renal function can increase the risk of proarrhythmia and other adverse effects. Flecainide is effective for atrial fibrillation and flutter conversion but is contraindicated in structural heart disease due to its propensity to exacerbate arrhythmias in such patients. Question 5. Mrs. White, a 35-year-old female who is breastfeeding, presents with symptomatic ventricular tachycardia. She is prescribed procainamide. Which of the following statements is incorrect regarding the use of procainamide in this context? Option A, procainamide is excreted in breast milk. Option B, it is safe for use during breastfeeding with monitoring. Option C, the primary metabolite is N-acetylprocainamide, NAPA. Option D, it is contraindicated in breastfeeding. Option E, monitoring of renal function is essential. The correct answer is option D, it is contraindicated in breastfeeding. The explanation is that procainamide is not contraindicated in breastfeeding. It is excreted into breast milk, but with appropriate monitoring of the infant for any potential side effects, it can be used safely. The primary metabolite, NAPA, is also pharmacologically active and necessitates careful monitoring, particularly in patients with impaired renal function, to avoid toxic accumulation. Question 6. Mr. Miller, a 62-year-old male with atrial fibrillation and a history of thyroid dysfunction, is prescribed amiodarone. Which of the following thyroid-related effects of amiodarone is incorrect? Option A, can cause hypothyroidism. Option B, can cause hyperthyroidism. Option C, requires regular thyroid function tests. Option D, it is not associated with thyroid dysfunction. Option E, thyroid dysfunction is due to iodine content in the drug. The correct answer is option D, it is not associated with thyroid dysfunction. The explanation is that amiodarone is indeed associated with thyroid dysfunction, both hypothyroidism and hyperthyroidism, due to its high iodine content and effects on thyroid hormone metabolism. Hypothyroidism is more common in iodine-sufficient areas, while hyperthyroidism may result from iodine-induced thyroid hormone synthesis. Regular thyroid function tests are essential for patients on amiodarone to monitor and manage these potential complications. Question 7. Mr. Anderson, a 62-year-old male with a history of atrial fibrillation and hypertension, is being evaluated for rate control therapy. His current medications include lisinopril and hydrochlorothiazide. Which of the following drugs is not recommended for controlling ventricular rate and atrial fibrillation in patients with left ventricular dysfunction? Option A, metoprolol. Option B, diltiazem. Option C, verapamil. Option D, digoxin. Option E, amiodarone. The correct answer is option C, verapamil. The explanation is that verapamil, a non-dihydropyridine calcium channel blocker, is contraindicated in patients with left ventricular dysfunction because it can worsen heart failure. Metoprolol and amiodarone are often used for rate control in such patients, while digoxin may be considered as an adjunctive option. Verapamil and diltiazem both negatively affect cardiac contractility and should be avoided in this setting. Question 8. Mr. Clark, a 58-year-old male with a history of QT prolongation, presents with palpitations. He is prescribed sotalol for ventricular arrhythmias. Which of the following is least likely to increase the risk of torsades de pointes in this patient? Option A, hypokalemia. Option B, bradycardia. Option C, hypercalcemia. Option D, concomitant use of macrolides. Option E, female sex. The correct answer is option C, hypercalcemia. The explanation is that hypercalcemia is not typically associated with an increased risk of torsades de pointes, unlike hypokalemia, bradycardia, and female sex, which are well-established risk factors. Sotalol itself prolongs the QT interval, and concomitant use of QT prolonging drugs like macrolides further increases this risk. monitoring electrolytes and avoiding bradycardia-inducing medications can help mitigate torsades in such patients.
Question 9.
Mr. Edwards, a 65-year-old male, is being treated for ventricular arrhythmias. He has a history of chronic kidney disease, CKD, and is prescribed lidocaine.
Which of the following statements about lidocaine is most accurate?
Option A, lidocaine is primarily metabolized by the kidneys. Option B, it blocks sodium channels in the active and inactive states. Option C, it is effective for supraventricular arrhythmias.
Option D, it has a long half-life.
Option E, dose adjustments are unnecessary in CKD. The correct answer is option B, it blocks sodium channels in the active and inactive states. The explanation is that lidocaine is a class 1B antiarrhythmic that preferentially blocks sodium channels in their active and inactive states, making it highly effective for ventricular arrhythmias. It is primarily metabolized by the liver, not the kidneys, so CKD does not usually require dose adjustments.
Additionally, lidocaine has a short half-life and is not effective for supraventricular arrhythmias. Question 10.
Mrs. Foster, a 72-year-old female with a history of coronary artery disease and atrial fibrillation, is prescribed digoxin for rate control.
Which of the following is not a common adverse effect of digoxin? Option A, nausea. Option B, visual disturbances. Option C, hypokalemia. Option D, bradycardia. Option E, hepatotoxicity.
The correct answer is option E, hepatotoxicity.
The explanation is that hepatotoxicity is not a known adverse effect of digoxin.
Common side effects include nausea, bradycardia, and visual disturbances such as blurred vision or yellow-green halos. Digoxin toxicity is often associated with hypokalemia, as low potassium levels enhance the drug's effects on cardiac tissues.
Close monitoring of serum potassium and digoxin levels is critical to prevent toxicity. This concludes our revision on antiarrhythmic drugs.
I hope this quiz session was both engaging and insightful. For deeper understanding, refer to resources like Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. These references will strengthen your knowledge. Note that any guideline mentioned in this video specifically aligns with the BNF.
Thanks for watching.
If you found this video helpful, don't forget to give it a thumbs up and share it with others.
Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.